Welcome to Motors and Medicine. On today's episode, I'm going to be discussing sinus infections and then a few topics regarding what exactly a sinus infection is, how to treat it, when to escalate treatment, that sort of thing. So first off, what is a sinus infection? Well, let's kind of get some background out of the way. What are sinuses? Sinuses are basically just cavities in the skull, and you have anywhere between 6 and 8 of them, depending on the person. Some people are born with fewer than others. Some people actually don't actually have a complete set of sinuses, but regardless, a sinus is just a cavity or an opening in the skull. And the reality is, the reason or the purpose for sinus cavities are to minimize the weight of the head, believe it or not. An average head or skull weighs about 12 pounds. And if our sinus cavities didn't exist, our head would weigh a lot more and we'd have some serious issues trying to hold it up. So credit to our necks for doing that. Now, back to the sinuses. We have a couple at the top called the frontal. And we've got some alongside the nose, deep back, called the ethmoid, and then a little bit below that we call them the sphenoid. And then we've got some just below the nose, above the upper lip in this region called the maxillary. And these sinuses, for all intents and purposes, are free air spaces, if you will. Now, they are lined with mucosal linings, and so they are susceptible to invasion and colonization and proliferation of different things. So let's get into that. Now, what are the main infiltrates, if you will, of the sinuses? The first being viruses. So airborne viruses are number one. And of course, you have a number of different viruses, but the most common would probably be like the common cold, okay? Now these viruses, and of course, as of more recently, we see that the coronavirus or COVID likes to infect the sinuses as well. That's just one of the places where that virus likes to invade through. So you've got viruses, and then depending on the time of year, you've also got allergens, which are brought on by plants and weeds and trees, bushes and such. And then if you live in this area where I live in the Salt Lake Valley, you've also got particulates that are in the air from inversion. And all of those things can lead to an inflammation of the sinuses, or sinusitis, which is the beginning of a sinus infection. So let's kind of go over that. The first thing that happens is your sinuses become infiltrated or infected by a virus. We'll start with the virus. And that virus starts to replicate, multiply, and proliferate, and then you start to get growth of that virus. Once it starts to colonize, then you end up with quite a bit of inflammation along the mucosal linings of those sinuses. And now you start to experience the symptoms of congestion, runny nose, cough, drainage, things like that. Now, those same symptoms will happen with exposure to allergens in the allergy season and particulates during the inversion season here in Utah. So if you live in an area where you have inversion or a lot of pollution, you can also suffer the same type of thing. So now that we know what types of things get into your sinuses and cause problems, how do we treat them? Or rather, when do we initiate treatment? And that's really symptomatically based. Once you start to experience those symptoms that I just mentioned, the congestion, the headache, the drainage, cough, then that's usually when most people start reaching for over-the-counter medications. Typically, a good approach is to use some type of expectorant, an antihistamine, maybe some nasal sprays, things like that. And for some people, that can be enough treatment. However, there are many people who, especially those who live in an area that's kind of got a combination of all three, where you've got viruses, particulates, and allergens all at the same time, like we do here in the Salt Lake Valley. So here, chronic sinusitis or chronic sinus infections are something that plague a lot of people and a lot of patients. Now, when I used to practice a lot of urgent care, I used to see sinus infections almost on a daily basis. Initially, my biggest question was, depending on the time of year it was if a person had any additional exposures, like if they had allergies. Obviously, if it was during the wintertime during inversion, that was pretty clear and evident. And then, of course, if they had any exposures to any sick people that they knew of. But beyond that, once you start with those symptoms, it now becomes a matter of how long are you going to maintain or sustain those symptoms before you start to consider, do I need to go in to see my medical provider for treatment? Now, a good general rule of thumb is to wait about anywhere between 2 and 3 weeks. If your symptoms persist beyond 2 weeks, but at least 3 weeks or so, and there's just no resolution, there's no remittance, your symptoms just won't let up, then it's probably a good idea to go in and get seen and see if you may in fact have a sinus infection. Because when you have sinusitis caused by an allergen, particulates, or a virus, the mucosal linings of the sinus really just start to allow for that inflammation, allows for a good breeding ground to be formed for viruses to multiply and replicate and proliferate and grow. And same thing with particulates, same thing with allergens. They just create a lot more inflammation, a lot more mucus. That mucus starts to build up, and then the buildup of mucus can then now attract the growth of unwanted microbes that otherwise would not be colonizing or proliferating in that area. So if you get to that point where you're beyond 2 to 3 weeks and you're just symptomatically just not able to control it with the typical over-the-counter medications, now it's time to go into the doctor's office and potentially get put on some antibiotics and perhaps like a nasal steroid or something like that. My approach was to initiate antibiotics once I knew that the symptoms were just not under reasonable control, and the timeline, minimum of 2 weeks, but in general, most of the time I'd see people who were about 3 weeks in. And so at that point, the type of antibiotic just depends on a lot of things. Number one, it depends on what type of antibiotics have worked for this patient in the past, and which ones will continue to work for, say, a sinus infection. So if you do have to go into the doctor's office for treatment for an antibiotic, it really is important to continue good hydration, some type of saline nasal spray, potentially a steroid spray, just to help mitigate some of the inflammation, because you don't want to just treat the problem and then the inflammation remains and you continue to have another outgrowth or another outbreak of infection. Some sinus infections are notoriously hard to treat, and so some of them may need, beyond your standard antibiotic, you need to get into some more broad spectrums. But the bottom line is, if you've reached that point, you go in, you get seen. A good approach is to get that antibiotic, use a nasal spray and or some type of steroid spray, continue the over-the-counters, and then hopefully within a pretty short period of time, that infection will clear, the sinus will become less inflamed, and the symptoms will, of course, start to abate. So hopefully this answers anybody's questions about sinus infections, what causes them, how common they are, what treatments to use, and when to really initiate further more profound care like antibiotics or nasal sprays that are steroid-based. So hopefully this information helped you guys out. Like always, please hit the like button, hit the notification bell. I appreciate your support. Subscribe if you haven't, and I'll see you next time here on Motors and Medicine. We'll get back into the cars, and I think I'm going to be doing an install on the Bronco for the next video. So till then, this is Motors and Medicine signing out. Thanks.